Okay, good morning, good afternoon, good evening, whatever time it is, wherever you are joining us across the planet here today. I'm Dr. Jeff Riggenbach. I want to thank you for joining us for this online course, The Personality Disorder Toolbox, The Challenges of the Hidden Agenda, and just working with so many of these personality disordered individuals in our treatment programs in our psychiatric hospitals over the last 17 years, and see so many people who use these evidence-based strategies and stick with it over time, really do get significantly better. And so that's really a message that I want everybody to hear here. It's really a central theme in my talks, whether I'm talking to professionals or working with consumers. All right, so I'm going to give you one slide on the evidence-based treatments of personality disorder. Then I'm going to jump into the foundations of the actual model, or really an integrated model. That's a combination of a few of those different evidence-based approaches. So that's what you can expect in session one, a long rambling explanation of session one. Session number two, then we're going to get into conceptualization, the importance of conceptualization. How do you conceptualize an individual case? And then how can you use that conceptualization to really drive your treatment planning all the way down to your documentation. So we'll cover that in session two. Starting session three, we'll get into these specific disorders. So session number three will be devoted to the cluster C disorders and the cluster A disorders. These are the diagnoses that we see least in the clinical setting. It's really one of the reasons that I assume it is anyway, that when people get cluster C disorders, because we don't see them that often, but sometimes you do get people that are just pretty dependent, or people that are, OCPD, or you get the occasional paranoid patient, or, any of these diagnoses, and people don't really know what to do because there's nothing out there on them. There's a lot of books on borderline personality disorder. There's really a fair amount of literature now on antisocial. But otherwise, most of these other diagnoses don't get much attention. So that's why I'm going out of my way to purposefully hit all 10 here in this course, so you have at least a little bit on each of these. So we will cover the cluster A disorders and the cluster C disorders in session 3. Now, because there is less on them, that will be a shorter, there's less on each diagnosis, so we're going to cram all 6 of those into one session. Session number 4, we're moving on to the non-borderline cluster B disorders. So that will entail a section on the histrionic personality disorder, a section on the antisocial personality disorder, and a section on the narcissistic personality disorder. Then we'll move into session 5, where we'll devote the entire session to the borderline personality disorder. Again, that is the diagnosis that you see most frequently in the clinical setting. It is probably the diagnosis that gives you the most headaches. So we will devote more time to that particular condition than any of the others. So in session number 5, we'll look at making a Bpd diagnosis, or if you don't make the Bpd diagnosis, at least understanding it and being able to converse in an educated but practical way that resonates with consumers, with family members, anybody that you need to talk to related to the patient's treatment. So we'll talk about understanding the diagnosis. We'll do a little section on differential diagnosis. I think Bpd is still confused with several other disorders, so we'll try to break through some of that confusion. And then we'll do a little bit of work on DBT treatment in this session 5. Session 6, we'll probably have to pick up a little bit of the treatment stuff. I do want to give you a little bit on traditional cognitive therapy treatment for borderline personality disorder. I want to give you a little bit on schema therapy, or at least what we might call schema modification treatment of borderline personality disorder. So really doing that deeper level treatment with folks. And then with what's left of session 6, we'll do some relapse prevention. Talk about ending treatment well, which for a lot of these clients, especially patients with abandonment-related beliefs, that can obviously present some issues from time to time. So we'll talk about ending treatment well and talk about some relapse prevention strategies. We really do want clients to not only get better during the course of treatment, but then stay better for the rest of their lives. It's really important in terms of longitudinal recovery, sort of long-term outcomes. And we know that's possible with this group now. So we really want to help as many of them achieve it as possible.